The DESKTOPIII trial was run by Andres Dubois, professor, and the AGO, which is the Germanic, if you like, oncology group, looking at the role of surgery in women with relapsed ovarian cancer who have what we call platinum-sensitive relapse. In other words, the actual time of relapse itself had to be a certain duration from primary therapy. And there were quite a lot of centres involved in this, looking at normal treatment, which was at relapse, give chemotherapy, but the other arm, the other randomization arm, was adding surgery to the chemotherapy to try and remove all of the disease, with a primary endpoint of overall survival. There were over 400 women randomized, and to date the overall survival primary endpoint is awaited, so we do have to be a little bit careful, but what is being shown already is that the progression-free survival and the treatment-free interval with surgery were both improved. And in view of that, whilst we have to wait for primary outcomes, it's looking as if, possibly in the future, that surgery will have an important role in these type of women in the relapse setting. And it's important to stress the fact that these are selected women. This is not every single woman who relapses at any time. So there's careful selection of these patients quite correctly. There's no real age boundaries at all. Most of these patients have advanced disease, understandably, because the vast majority of those do relapse. But the average age is 62, was the median age of the patients, which is very much an ovarian cancer population, even a primary presentation. Yes, I think in fact that will happen, and immunotherapy already kind of targeting PD-L1 is ongoing presently in early phase trials in ovarian cancer. So we are cognizant of the fact of the importance of immunotherapies. We know in advanced ovarian cancer, for example, the greater the number of T cells within the tumour relates to prognosis. So there is a great interest in that, and an evolution, if you like, very much of immunotherapy being the thing at the moment. So that will come in combination with surgery, because surgery and chemotherapy together in all settings, if you like, of ovarian cancer, but definitely in primary setting, are quite an important combination. Well, I don't have that information at the moment. They're quite surprised really at the fact that the events and that the overall survival was actually so good. But I would have thought, at a guesstimate, we're probably talking about another 6, maybe 12 months maximum for the full publication to come out. But that is very much a guesstimate because everybody is waiting to see what happens. So it was an unexpected fact that people actually were doing so well. But that's good news for patients.